The interrelationship between periodontal disease, caries, and occlusion. Years ago, Ballantine beer had interrelated rings, which you see here, and I've copied that, and we're going to talk about the interrelationship of periodontal disease, caries, and occlusion, because as you all well know, they are very much interrelated. For the last few years, I have been focusing on teaching the Miller-Mcentire Periodontal Prognostic Index, MMPPI, which shows from a periodontal standpoint that teeth can be scored and can have an excellent prognosis. Now, as I've mentioned before, it's evidence-based, statistically validated, it's very accurate, and it's been published in the February issue of the Journal of Periodontology. And finally, most importantly, it has been clinically certified or validated by the American Academy when it was given the Clinical Research Award in 2015. And I would like to emphasize that the Academy gives only one Clinical Research Award for the year on all the clinical research that was published the year before. And here I am receiving that award. So let's go into caries now, because that is the second circle on that. And we talk about occlusal caries, interproximal caries, and the most significant one as far as prognosis goes, in my opinion, is root caries. And in the last few years, we've come up with meth mouth, which is a whole different animal and makes caries treatment extremely important in the meth mouth. So, let's talk about this interrelationship. The importance of a sodium hypochlorite as a mouthwash. It's highly effective, it's inexpensive, and it's safe. And you can go to this link on my web textbook, The Most Effective and Least Expensive Mouthwash, where you can get details on that. And I think not only in controlling the bacteria in periodontal disease, but also the bacteria associated with caries, this solution can be very impactful in both of those. We all know the impact that fluoride has on preventing caries, going back to the 1950s when topical fluoride was used and now fluoride in the water. So it can be applied topically. It can be used custom trays on caries. And also, there's some new research done by Dr. Mullen Coover at the Medical University of South Carolina that on superficial caries, especially interproximally, where the caries has not gotten through the enamel, that this can be recalcified rather than the area be restored. 2 thumbs up for Mullen Coover. So let's have some thoughts on teaching effective toothbrushing. This is a little video that I made about a month or so ago, and I've actually modified the way that I brush based on that. Because what you do when you brush, you don't think about what you're doing, and you think about what you're going to be doing all day long. But if you actually put a little thought in this and follow the recommendations on this, I think you will find that you will brush much more effectively. And finally, the cure for bad breath. These are the bacteria found on the posterior third of the tongue, and it's necessary, in my opinion, to remove those as well if you're going to have a complete oral hygiene program. And when it comes to caries, we need not to ignore diet, because diet becomes very important. And we know the importance of refined sugars, carbohydrates, and also the impact of soft drinks, which a lot of people don't take into consideration. The final ring on this is the occlusal aspect of it, and this is mechanical trauma. We talk about primary occlusal trauma, which is trauma to teeth that have a complete periodontal support, whereas secondary occlusal trauma is on teeth that are compromised periodontally and have significant bone loss. Occlusion, the basic treatment. When I was in my residency many years ago, we spent an awful lot of time trying to sync acquired centric into a retruded centric or true centric relationship occlusion. I don't think that's as critical as I once thought it was, but I think a lot more emphasis needs to be placed on the lateral excursions, or what was referred to as the envelope of function. This includes non-working, working, and protrusive contacts. And non-working contacts certainly are non-functional, and you do not want those in a normal occlusion. With working, an anterior disclusion or a group function, whichever you prefer, works quite well. With protrusive, obviously, we would like to distribute protrusive on as many anterior teeth as possible, and certainly we do not want to have posterior protrusive interferences because that can trigger bruxism. Talking about bruxism, we've got occlusal adjustment in doing this, and you can do that certainly with orthodontics. You can also use various appliances like deprogrammers and occlusal guards. This short video is designed to give you an overview in abstract form, if you will, of overall dental prognosis. Certainly we can talk about accidents and trauma, but the three major things that determine the dental prognosis are periodontal disease, caries, and occlusion. And the interrelationship of these does determine the overall dental prognosis. As I said earlier, this is not designed to teach you how to manage periodontal disease or caries or occlusion, because these need to be dealt with in depth. But this is just an abstract to go over to put everything in perspective. I hope you enjoy it.